This is the Emergency Medical Minute, sponsored by Health One.
So I will continue on my opioid kick. What are the three drugs that we use for MAT? No, MAT in terms of medication, medication for addiction treatment. Suboxone, great. Methadone, great. And? No. It's Naltrexone, right? Or Vivitrol, as it is better known. So, okay. So of those, naltrexone is pretty special when it comes to pain control, and the reason why is because it's a full mu receptor antagonist, right? So if it's a full it's a full mu receptor antagonist. What does that mean for your opioids, your traditional ones? They don't work very well. So if you see a patient who's on Vivitrol, it's a 1-month shot. So if they come in for pain control or they have a new acute fracture and you're using just traditional morphine and stuff, it's not going to get you very far. So what you have to do with those patients is really, one, try to lean on your altos and use nerve blocks or use ketamine. Or two, if you do use opioids, you have to go very, very high with your doses. Okay. So what's the common opioid that we give that has the highest mu receptor, affinity that you can overcome something like naltrexone with? Not fentanyl, surprisingly. Not carfentanil, probably, but it's Dilaudid. So you should just use really high doses of Dilaudid if you have a patient who comes in and they've got an acute trauma or something else and you feel like opioids are appropriate. You just have to use very large doses of preferentially Dilaudid to overcome that naltrexone blockade. Okay? So short and sweet, naltrexone makes pain control harder.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.